Hi, this is Alyssa Cady, the director of the Greater Hewitt Chamber. We're excited to introduce you to Dr. Andrew Oestreich with Landmark Chiropractic. He will be sharing tips and benefits of chiropractic practices and how it can benefit everyone for the whole family. So, Dr. O, how are you today?
I'm doing awesome. Thank you so much for having me, Alyssa. I'm just so excited to be able to share a little bit about myself and how my office is going to be able to serve the families here of Waco, Texas.
We're so happy to have you. This is Megan. I'm the communications coordinator here, and we just want to get in straight to it. So tell us a little bit about yourself.
So I was born and raised in New Braunfels, Texas, just a little bit south of here. Go Unicorns! Shout out to our Unicorns there. Sports and music was a big part of my upbringing. Played basketball and tennis, as well as being in the band while at New Braunfels. And really from a young age, I knew that I wanted to serve in healthcare. And really what got me into chiropractic was shadowing my chiropractor when I was a senior in high school and just seeing the amazing things that I saw in that office of hope and healing. I didn't know what was going on. He was just kind of, assessing the spine and making some corrections, and people were feeling amazing. So I said, I don't know what you're doing, but I want to do that. And so that journey took me to the University of Texas at Austin for kinesiology. So I studied exercise science there with a focus on athletic healthcare. And I graduated there and went to Parker University College of Chiropractic, and I graduated there in 2014. So it's been a great journey, and eventually got me here to Waco.
That's so great. So, okay, you're in Waco now. Where is your office going to be located, and when will you be opening up?
So the office is going to be located right here in the Target Plaza off of Bosque, and the goal is to be open here by the end of the summer.
That's awesome. So we have spoken before, and we've talked about places that you've worked and all the really impressive list of places that you've been. So tell us more about those.
I've been very fortunate to have some great working experience and some great mentors in my life. And I did my senior level internship at the VA hospital in Dallas, working with the veterans there. And it's just a true blessing to be able to serve them just as they've served our country first. And really to be able to help them on that path to healing after a lot of the, just sometimes the very traumatic things that they've gone through was really just a great opportunity for me. From there, I've actually served in about 6 different offices across the state of Texas, from Dallas to Fort Worth to San Antonio to Boerne. So just being able to be able to work and shadow and grow in these different offices has really been a great part for me. And I spent the last year in upstate New York working in one of the largest family practices actually in the Northeast United States. We were serving about 1,000 families a week through our doors there in New York, and just saw some amazing health results happen. And so I finished there in February, and I moved down here to Waco to open up my own practice here to serve the families here, and that's where I'm at now.
And we're so happy to have you. So for those of us who don't know anything about chiropractic, can you briefly describe what it is that you do and how it works?
Absolutely. So chiropractic, a lot of people think it's the big 3, neck pain, back pain, headaches, which we see amazing results with that. So really at its core, chiropractic is focusing on the nervous system in the body, right? And so the brain and the nervous system controls every single function that we've got, right? It tells our heart to beat, our lungs to breathe, our stomach to digest food. And it does so by sending signals from the brain through those nerves to every single cell, tissue, organ in our body, right? And our spine, that spinal column, is designed to really protect and house that nervous system. What can happen, though, is that from the stresses of everyday life, whether they be big stresses, car accidents, sports injuries, falls, things like that, whether they be kind of the small repetitive things that we do every single day, sitting at our desk with bad posture, picking up after our kids, going to work day in and day out and working those hard jobs. Yeah, we've got hands raised. A lot of times those small stresses add up, and it actually causes those bones in our spine to shift out of their proper alignment. And when that happens, it leads to irritation and inflammation around those nerves, which a lot of times is the direct cause of the aches, pains, and dysfunctions that we feel, in our life. So, what my job as a chiropractor is to do, especially specifically a neurologically based chiropractor, is to figure out exactly where those misalignments are at, and then gently, specifically guide those bones into that proper position. That's going to take the pressure off those nerves, clear up that inflammation, and really restore that proper communication of health and healing from that brain into the body and back.
That is a lot of information. So you assess the nervous system. How do you do that? And is there a test that you do that helps you find your information?
Yeah, so a lot of what I just said, yes, there's a lot of information there, but when you're in the office, we make that so simple. We've got some amazing technology that really no one else here in the city of Waco is going to have, to be able to break it down for you so that you can know exactly what is going on with how that nervous system is functioning. We've got NASA certified space station technology to assess the nervous system. So the first one is our nerve assessment. It measures it's a thermal scan that we start at the base of the spine, really the bottom of the back, and work our way up to the top of the neck. Okay. And what it does is it measures the temperature from one side of the spine to the other. Okay. Really, in theory, the left and the right side should be the exact same temperature, right? The air conditioning is always 72, so it shouldn't have a change. But what happens though is that when we have those misalignments, like I said earlier, it can lead to that inflammation around those nerves. So I can see exactly where that inflammation is at along those spine. So I can see exactly where I need to focus my care at when you come into the office, because, my needs are going to be different than yours, Alyssa, than yours, Megan. So, to be able, chiropractic isn't cookie cutter. So each person has individualized health needs. So this helps me, figure out where, your body needs that help the most. And as well, I've got a muscle assessment. It's called static electromyography. It's a big fancy word. Same thing as an EKG, so when you watch, Grey's Anatomy, and they put the wires around the heart and they do the EKG on the heart, same concept, but we do on the back of the neck and on our back muscles. And it tells us if our muscles are really firing too much, maybe those muscles are firing too little. So we have too little, tension and stability in those areas. So again, we can see how that body is functioning, and if we have that strong support around that spine and those nerves that are coming out of there too. So we can get as specific as possible, along with, a consultation, along with a palpation, really kind of motioning some of those areas to see, hey, are there areas that are painful or have a little restriction too? So combining all of that, it's a very objective information. So a lot of times what we're thinking of, it hurts here. Right, I've got this pain here. Well, I don't want to just chase pain. A lot of times when we chase pain, that's just kind of like a dog chasing its tail. We're not always getting to the root cause of it. So if we can combine, your subjective, this is kind of where I'm feeling these symptoms, with this objective of how that body is functioning, that's really where we're able to get some of the best results.
That's fascinating. So you talk about how no two bodies are the same. And me and Alyssa always talk about like our kind of like what our mommy bodies and how we, how they differ, but also all bodies are different. And as you mentioned that, and then you say that you work with, you work with different types of clients, and you talk about family chiropractic care. Does that mean that you take kids in your office?
Yes, we do take kids in the office, and that's really where it gets fun. That's also where some of the chaos happens in office too, when you got a lot of kids running around. But that's the energy that I love having in the office, just being able to feed off of that. And chiropractic for kids is hugely, hugely effective. We've seen improvements with sports performance. We've seen asthma, allergies, chronic ear infections. We've seen spectrum disorders see improvement, even seeing newborns in the office. So a lot of times with kids, if kids are expressing symptoms, again, this is the first time in history that our kids have a lower life expectancy than, the previous generation. So our kids nowadays are honestly sicker than they've ever been. And I'm just so passionate about, not if we've got kiddos, not being reliant on medications. We shouldn't have to be having our kids on just antibiotic after antibiotic after antibiotic, or on a lot of these different prescription medications. Our kids are designed to be healthy, and they're designed to heal so much better than we are. We've stressed our bodies to the max a lot of ways, and their bodies are designed to heal and thrive. And the more things that we can do to prevent a lot of this sickness and a lot of this illness, and just really strengthen that nervous system, strengthen that immune system, strengthen that body overall. That's really where true health and healing comes from that preventative side, not from the, oh, we've lost health, now we need to work to try to bring it back. Let's keep it and maintain it from the start.
Awesome. You mentioned kids on the spectrum. I'm a mommy of a kid on the spectrum, and I mean, I've thought about it before, but I'm really interested. How does chiropractic work for kids on the spectrum?
Yeah, and with kids on the spectrum, never am I going to say, that chiropractic is going to be able to heal, to cure 100%. That's not what I'm here to talk about. But what I am here to talk about is that those same spinal misalignments that I was talking about earlier, when we have those misalignments, putting stress and tension on those nerves, that dysfunction can manifest itself in a lot of different ways. So if we have stress and tension on certain areas of the spine, that can just lead to a lot of stress on that body too. And so really that misalignment causes that disrupted communication from the brain to the body and back. So when we're able to find those areas of stress and strain on that spine, remove that stress, better communicate brain to body, there's really no limit to how much that body is able to heal. Because, when you come to a chiropractor, I'm not doing the healing. Your body is doing the healing. All I'm doing is just kind of removing the barriers to it. We've seen kiddos in the office that have gone from nonverbal to verbal. We've seen kiddos in the office that have gone from no contact, don't touch me, stay away from me, to giving hugs. We've seen just really personalities come out on that spectrum. And just the way that we do that, hey, let's just try to remove as much stress and tension on that nervous system as possible. If we do that, there's no telling what the limit to that healing potential is. So it's the same concept as anybody else coming into the office. All I'm doing is locating where that stress and tension is at on that nervous system, helping remove that, and then let the body heal and function the way that it's supposed to.
As a mom of a kid with autism, I mean, that sounds incredible, and it's very, very intriguing. And I know that a lot can be changed, and we're so excited to have you here and doing that work. So you said something about newborns in your office. Do you see newborns in your office too?
Yep, we definitely see newborns, and I'll preface this too is that really a newborn adjustment, and a couple days old versus all the way up to a year old, 2 years old, that adjustment's going to look a lot different than it would be for an adult, right? And so why do we see newborns? Why do I want to see kids at such a young age? Well, if we go into that birth process just a little bit, not too much, but we'll go into it just a little bit. A lot. I mean, I've heard stories, and I'm sure y'all have friends, or maybe even yourself. I mean, you've had difficult labors, prolonged labors. Maybe the pregnancy, there were some difficulties with the pregnancy too. Maybe a lot of pain for you, a lot of discomfort, a lot of those things. And so what can happen is that if we have, a very difficult labor for mom, that's also a very difficult labor for baby too. If we're pushing, that's a lot of stress and tension that we're putting on baby. And so really what we encourage is say, hey, let's just bring that baby in. Let's just get that nervous system checked, right? Because if that birth process was traumatic on baby, if there was a lot of twisting and pulling on that baby's neck, I mean, if you've ever watched videos of kids being born, a lot of times those doctors are pulling on that baby's neck. I know, and we're kind of scrunching up right now. We're cringing right now, and that's just the fact of the matter is that a lot of times we're putting a lot of stress and tension on that baby's neck. Well, what's the when you're first time holding a baby, what's the first thing that they tell you to do? If you want to hold a baby well, what's the first thing that you need to support?
Their neck.
Yeah. You need to support that neck. But a lot of times, that's exactly where we're putting a lot of that stress and strain, bringing that baby into the world. So, they've done research, and 70% of kiddos after the birth process have a misalignment at birth. And so we say, hey, let's get that checked out. If there is one, let's correct it. Again, let's be on that preventative side, because if we have those misalignments and that stress and tension on that nervous system from birth, that just adds up over time. And that's where, maybe we may not see it, now in 5 years, 10 years, 15 years, 20 years, but down the road, those things add up when we could have just started taking care of it at the beginning. So it's very gentle. It's very specific. Hey, let's get it checked. And if there is a correction that needs to be made, why don't you go ahead and take your finger and put it on your eyeball and just put a little bit of pressure there. That's all a newborn adjustment looks like. It's just a very light, sustained contact. Their bodies are so, so malleable and so, really so fragile. And so it just takes a little bit of pressure to guide those bones in that proper position. And it's so cool after you see an adjustment for little boys. A lot of times, they'll just take a big yawn, and sometimes they'll just fall right asleep. And it's just the cutest little thing. So that's why, we see our kiddos in the office.
Okay, so when we talk about newborns and all of the ways that we kind of the way that the techniques that you use to adjust them or to just kind of assess whatever it is that they need, tell me more about the Webster technique.
Yeah, so the Webster technique was really specifically designed for our pregnant moms coming into the office, right? And so to be a family chiropractor, you need to be able to see people in all stages of life, right? And really one of the biggest stages in a family or a young family's life is going to be during that pregnancy, right? And so the Webster technique is designed to address those specific changing needs that a mom has as her body is developing, during that 9 months. And it's really specifically focusing on the hips and the sacrum, which is kind of that triangular shaped bone right between the hips, kind of the tailbone is what we see. So the reason we focus on that is because that's where, baby is growing, is going to be in that area, right? And so if we can maintain a very solid, strong foundation in those hips, in that sacrum, which is really determining the shape of that womb, then that's going to lead to a very strong foundation for where that baby's going to be able to grow and develop, as optimally as possible. A lot of times when we have moms coming in, they're maybe 6 months, 7 months, 8 months pregnant, maybe baby's breech, maybe baby's, sunny side up, maybe baby's transverse, a lot of these things. And a lot of people know what's the reason for that. Well, my opinion on this is that baby is just trying to get comfortable, right? He's got a very defined set of space, or she's got a very defined set of space to be able to grow and develop in. And so if really that room that baby's growing in is changed, the blueprint of that room is changed, well, baby's just going to follow along with that blueprint, right? And so if we can get that area as least amount of stress and tension as possible, get everything moving and functioning the way they should. That's why after some adjustments, again, no guarantees, but after some adjustments, we've seen kids go, head down the way that they're supposed to, which is amazing. And we're not treating anything. We're not moving babies. All we're doing is just, allowing mom's body to function as best as possible, because those nerves that are coming out of that low back and those hips are those same nerves that are controlling a lot of communication to baby's development. So it's really just focusing on strengthening, that mom structure to allow for that proper development of baby inside.
That is so cool. And so now, like, hearing all of this, having the difference between the techniques on a baby, and then a pregnant woman, it's got to be, they're both kind of touchy, they're both, you have to be kind of fragile, and there's things that that are more sensitive, I guess, than you would have if like a grown man with a back problem came in versus like a tiny little infant baby. So tell me some more about the difference between an adjustment for a baby and an adult, and what they look like or how they look the same.
Yeah, very, very, very different, very different than if we've got, my dad built houses. And so his body structure is a lot different than my mom's body structure, who, is a teacher, and versus my friends who just had, a 5-month-old Luca, who just had him, like all those different body types are very different. And so really it comes down to a lot of times we'll start with an adult, an adult adjustment. So a lot of times So if I just had, if you were coming into the office, Megan, and I'll have you lay down on the table, you lie down face down. And what I'll do is I do a leg length analysis. All right. So the technique I use is the torque release technique. There's 300 different techniques in chiropractic, but I found that this one, I chose this one because it was born out of research. It's been proven to work. It's been proven to be reproducible. And that's really what I love about this technique, is that I'm all about proven results. I'm a results oriented person. If we're not getting results, then we got to make sure we're doing things to get results. So the way that I adjust is I'll do a leg length check. So everyone's got a short leg. Everyone's got a long leg. You're not broken. No, you're not broken. And I'm not saying, everyone's got a structural one, but everyone's got a functional short leg. All right. So if everyone were pretty much to lay down on the table, one leg, whether it be the right or the left, would be a little bit shorter than the other. All right. And so what my analysis does is I'll assess different parts of the spine and to find where those feet go perfectly even. All right. Because when I assess that part of the nervous system, if that's where the biggest amount of stress and strain on those nerves are at, your body will tell me this is where we need to make a correction at. Those feet go perfectly even. So then I go in there, and I've actually got an adjusting instrument. It's called an integrator. You kind of hear this pen click. It's almost the same, almost the same sound, but I can go in there and make a very gentle but very specific adjustment just to that segment. Nothing more, nothing less. It's not painful whatsoever. It's just right setting up on that segment. I make that correction, and then I post check, I double check, I recheck that area. Do those feet go even? If they don't, perfect. That adjustment has cleared. Those nerves are communicating 100% at that level. Now let's go find the next one. And I'll do about 3 different segments on that. So in my office, it's not a lot of popping, twisting, and cracking. I can do a lot of those things, but again, I'm results oriented. I want to be as specific as possible. So for an adult adjustment, looking anywhere from 3 to 4 segments each time, really utilizing that leg length while you're lying face down. So for kiddo, a lot of times we don't have up to about 1.5 years, 2 years, we don't have a lot of the same reflexes. So I can't do that same leg check that I can on an adult, because just developmentally, we haven't got there yet, right? And so a lot of times we'll have them we have got some pregnancy pillows which is great for mom. Kind of backtrack, is great for mom. Mom can lie down face down, which you can never do during her pregnancy, and they love it. So it's basically like a pillow that's got a little bit of a basin cut out in it for the belly. So a lot of times we'll just lay the baby in the pregnancy pillow, just face up, play with them a little bit, smile, have them laugh, and I'll kind of do a different leg check, looking with them looking up, but do a little bit of a different leg check. And what that adjustment will look like, again, is just that same amount of pressure that you put in your eye, or to see if a tomato is ripe, just a little bit of a sustained contact. Just kind of find that area with the most stress and tension. A lot of times in that upper part of the neck, just because that's where we're seeing a lot of the most motion, things like that. And there's actually 70 trillion nerves passing through that top bone in our neck, which is a lot. And so a lot of times we focus on those top bones in the neck, just a gentle pressure. Sometimes they'll just sink into it and kind of push into it. And it's really only 1 to 2 segments for a kiddo. And that's it. So it's very, very different. And it's really, with kiddos, less is more, right? Less is more. Their bodies are healing and growing and developing. So if we were to do too much, again, that's never what we want to do. We never want to do too much, especially with the kid. Less is more. Let their bodies do a lot of that work. And that's really where it's really cool seeing some of the things. So for a newborn, what are the biggest things that parents come in for? Latching issues. A lot of times, maybe they got torticollis. They can't turn their head, and feet on both sides. So being able to restore that proper range of motion from both sides. Colic, right? You just, baby's crying, digestive issues. Well, is that digestive organs not functioning because they're not getting that proper nerve communication to function properly, because there's misalignments, in that low back or in that sacrum area. So again, just being able to make sure that nervous system's communicating as best as possible, so that they can function as best as possible. So colic, latching issues, chronic ear infections, that's one of the biggest things too. We just, I've heard horror stories, tube after tube after tube. I've even heard that one kid was allergic to the tube, so they had like a major allergic reaction to that. And you're just, yeah, oh no, you're like, oh my gosh. And so there's such an intimate relationship between that nervous system and those nerves controlling, a lot of that immune system, and playing a relationship with that structure in that ear canal for that proper drainage. And who would have thought that chiropractic care would be able to help with chronic ear infections. We've had kids cancel surgeries. We've had just amazing things happen. Night terrors, anxiety, bedwetting issues. I mean, it's just really cool when the body is functioning at its optimal level, when that nervous system is communicating up and down, back and forth as best as possible. That's where true health comes from. And that's really what I'm looking to see with each and every kiddo that's coming in through the doors.
Hearing you talk about it, you can tell how passionate you are about it. And you can see it when we talk, we've spoken before about like all the things that you're really excited about to bring to Waco, and all of the things that you can just see that you're on fire for it. So let me know, why are you so passionate about serving families?
I think here in Texas specifically, but really, I mean, really when we come down to the things that if we were to ask people, what's your most important thing, in your life? I think here in Waco, we're number one would be God, which is a great thing, but a very, very, very close second would be family, right? A lot of times we'll do anything for our family members, whether it be time-wise, financial-wise. We'll go out of our way to serve our families. And healthy kids turn into healthy adults, right? And so if we can have our kids healthy, they're going to be able to have that same service back to their kids, when they have them, at a very, very high level. And if we don't have our health as ourselves, if I'm not healthy, I'm not able to serve and help my family if I'm not physically able to. And so I need to be able to take care of my health to be able to serve and give back to my family as much as I want to. I'm sure your same thing, moms, like if moms, caught the same bug that kids got, right? It's a lot. The whole family's down, and dad's like, oh man, I don't even know what I'm going to do now, because now I got to do stuff. And so to have healthy families is just so important in, I think, that happiness of life, so that you can pursue your passion and pursue your purpose, and to be able to serve your kiddos. So that healthy family is something that I want to see each and every time that I go out into the community, because if we don't have our health, it's really not a lot that we can do.
Okay, so I'm a huge advocate of chiropractic care, but let's pretend that I wasn't, okay? Tell me what it would be like if I were to come into the office, and what the first visit would look like.
So that first visit, really, so what we'll do is we get you scheduled for your initial visit. You come in, bring your insurance card first off. That's like one of the biggest questions, is chiropractic care covered under my insurance? Bring your insurance card. We'll do a complimentary benefits check for you, just to let you know what that coverage looks like. And then we'll have you fill out the paperwork, and then we'll sit down for a consultation, just kind of going over your case history, what's going on, how long has this been going on for, those types of things. And then what we'll do is we'll do that neurological evaluation. We'll do that nerve assessment. We'll do that muscle assessment as well. And then based off what we're seeing there, we'll go over those findings with you right then and there too. It's not one of those you got to come back three weeks later. We'll go over those findings right there with you. And then based off of those, if x-rays are indicated, we can take those right here on site at the office too, just so we can see, okay, now that we can see that, hey, maybe there's some dysfunction, there's a lack of function in some of these areas. Well, we want to make sure that we check the structure too, because structure determines functions, right? And so we'll look at some pictures to see, hey, do we have any loss of curve? Do we have any degeneration? Do we have any arthritis? Do we have any of these things that we can see structurally that's leading to dysfunction? Because to see is to know, and not to see is to guess. And we never want to be guessing, especially when it comes to our health. So we'll take those x-rays that day, And then what we'll do is we'll get you scheduled for your second visit. And that second visit is going to be the most important one. It's our doctor's report. All right. So we're going to go over those x-rays with you. We're going to go over our overall findings, our care plan recommendations. Hey, this is what we think is going to be the best route of action to get you to your health goals. Then on that second visit, we can get you that opportunity to start that day on that road to health and healing.
That is so great. And it happened that quick. I mean, that's fantastic because you want to feel better and you want to feel better fast. Okay. So how can we contact you?
Yeah. So that is a great question. If you can go online, the website is landmarkchiropractic.com. You can look on Facebook or Instagram for Landmark Chiropractic. Pick the one in Waco. I'm pretty sure you should be able to @Waco Chiropractor as well to be able to do that. And if you ever have any questions, you can email me directly. I'll give you my email address here. It's my last name. So it's Oestreich, DCOESTREICHDC@gmail.com. I'd love to be able to answer your questions or be able to help guide you on that road to health and healing as best as possible.
That's so great. Thank you, Dr. Oestreich, for coming in and letting us know. It was an educational visit for sure. There was so much that we didn't know, and we're excited to have you in town and be able to come and visit you. And we're just looking forward to supporting your business as the best we can. Thank you all so much for tuning in, and we look forward to our next webinar.